Hello, hello, everyone. Linda Pellegrino back with you here on Senior Radio Buffalo. Thanks so much for joining us every weekend. You know, you can always give us a buzz on the Linda line if you have some questions about the show. But as you know, we're here for you every weekend, and we like to have the latest information on everything to help enhance your life. Now, you may have heard that, where everybody seems to be on a line waiting to get their COVID vaccination. But I have to tell you, if you remember, go back a couple of months and remember when President Trump had COVID, he took an infusion at the hospital, okay? And you saw how quickly he rebounded. Well, I have to tell you, what he took was something called a monoclonal antibody infusion. And you know what? That is now offered here in Western New York at the Harris Hill Nursing Facility. And if you have been diagnosed with COVID, but you have a mild case, those residents have been given this infusion. And you know what? They're doing really well. Now, let me tell you about Harris Hill. They have a temporary designation as a COVID-only facility that admits patients who tested positive from area nursing homes, assisted living facilities, and hospitals who require care and isolation. Harris Hill has the advanced clinical setting equipped for these infusions. All right, and this is from Dr. Zerline Snyderman, who's a medical director for the McGuire Group. And Dr. Snyderman quotes, "We know during the pandemic that the vulnerable elderly are the most at risk for serious outcomes from COVID-19. Western New York is in a second surge, and hospital capacity is a concern. We moved swiftly and collaboratively to bring monoclonal antibody infusions on site as an intervention to treat high-risk patients with recently diagnosed COVID-19 infection." Now, the drug is available to residents of the Harris Hill Nursing Home through a partnership with DeGraff Medical Park Infusion Center, which received the state's allocation of the monoclonal antibodies. The team at Harris Hill Nursing Facility has been working closely with Dr. Nadler, Assistant Professor of Medicine and Medical Director of Quality and Patient Safety at Buffalo General Medical Care and Gates Vascular Institute, on developing protocols for administration and aftercare in concert with those specified in the EUA. And Dr. Nadler says, "We are excited to partner with McGuire Group as we try to expand outpatient treatment options for all of Western New York." Now, right now, these are given to resident patients, okay, those who are there right now. And we're going to find out how this is going because we have Danielle Reusch, who's with us. She is the assistant administrator over at the Harris Hill Nursing Facility. And we have Annie Spano, who's also with us, who is the director of nursing there. So good morning, ladies. It's very, very exciting news.
Good morning, Linda.
How is it going so far? How many residents of Harris Hill have received an infusion, and how are they doing?
We're at approximately 10 patients right now who have been infused with success at Harris Health.
That's fantastic. And when did this become available?
This became available at Harris Hill Nursing Facility on December 29th.
Okay, so you have been watching these patients, and if they qualify, if they are diagnosed with a mild condition of COVID, okay, then this is a proactive treatment different from the vaccine.
Absolutely. The monoclonal antibodies can be given within 10 days of diagnosis of COVID, and it helps to stop the progression to a moderate or severe case of COVID.
That's great. And you're saying that you can see a difference in the patients within 24 hours?
Yes, correct. Those patients that have been infused thus far are reporting what a positive turnaround and positive effect that they're having that following day.
This is for people who have been diagnosed with COVID, but so far are having a mild case. Why doesn't this work for those who have a severe case?
So the monoclonal antibodies are intended for those patients that are having those mild and moderate symptoms before they reach severe, because we want to minimize those symptoms before they progress into that severe symptoms, and also those hospitalizations.
And we would like people to know that even if you have an infusion, that 90 days down the road, you still should get the vaccine.
Absolutely.
Yeah. Is anybody else in Western New York offering this?
So another one of our sister facilities, Autumn View in Orchard Park, is starting their infusions tomorrow. But as of right now, we are the only facility in Western New York, the only long-term facility in Western New York offering this.
Wow. Do you think that down the road this will become more of a mainstream treatment?
We certainly hope so.
Yeah, because it seems like, this has really, really gone very well. Any side effects?
At this point, no,
Wow.
not on our end. Everybody has handled it very well. There's been no reaction before, during, or after the infusion, and the days following, nothing.
How long does it take to get the infusion?
The setup pre-infusion is typically around a half hour to 45 minutes. The infusion itself is 1 hour, and then the post-op is typically 1 hour.
Wow,
so it's usually about 3 hours.
Well, this is really news. This is great news for so many people. Danielle, maybe you can tell us about the other services available at Harris Hill Nursing Facility, because it really, really can help so many different people.
Absolutely. Skilled care is exactly that. Skilled hands providing exceptional service. The benefit to having the monoclonal antibodies in-house is that you have the familiarity of staff. You have on-site location. Especially with your dementia population, which might confuse the dementia person, they can stay on-site. They could also, including the next day, get back up and get participating in occupational therapy, physical therapy. We have dietetics on site. We're treating the person holistically, and this is one more tool to add to our arsenal in providing great patient outcomes.
That's fantastic. And once again, we want to reiterate what we're talking about, that the Harris Hill Nursing Facility, a 5-star rated nursing, skilled nursing, and rehabilitation facility operated by the McGuire Group, is the first nursing home in Western New York to offer monoclonal antibody infusions for the treatment of high-risk COVID-19 patients. So if you're a resident at Harris Hill and you have been diagnosed with a mild case of COVID, you indeed would be eligible for this. And ladies, you also tell me that this is soon going to be available for the same type of patient over at the Autumn View facility?
Correct, yes.
That's fantastic. That is really great. And the McGuire Group has really been very, very proactive on this. So obviously this is through a partnership with DeGraff Medical Park Infusion Center, which received the state's allocation for the monoclonal antibodies. So we understand that your team was very well educated on what this is all about and how to give these infusions, correct?
Yes, correct. So, while our registered nurses already have the skill set necessary to administer this infusion, we did partner with DeGraff and their nurses and worked in collaboration to adequately train and make sure that our nurses are proficient in this specific infusion.
And ladies, I guess really the proof of the pudding is to see how well the patients are doing right afterwards. And as we know, COVID can have such a long a long recovery period, but yet you say this type of treatment, you're actually seeing improvement the next day.
Correct. Yes, we've had really at this point all success stories. It's amazing to see those patients that are having those mild symptoms and just really not feeling themselves, and miraculously the next day those symptoms have minimized. They're able to function back to their baseline and really get back to where they need to be.
Wow. And remember when President Trump was diagnosed with COVID and he went into the hospital and it seemed that he was getting better very, very quickly, this is what he had. He actually had a monoclonal antibody infusion. And we saw there was the proof of the pudding. And now to know that this is available here at the Harris Hill Nursing Facility and also at the Autumn View facility, it's really been great and very, very proactive by the McGuire Group to be working with DeGraff Medical Park Infusion Center to get this out to local patients. This is very, very exciting, ladies, and you have to be very excited to have this there.
We are, we've been dealing with COVID now, and the community has been dealing with COVID now since March. So if anything, it's that light at the end of the tunnel, along with the vaccination and this infusion. We have things now that we can help our patients and get them on the road to recovery and get back to where we need to be.
As we just said, you have to be diagnosed with a mild case of COVID and be a resident over at the Harris Hill Nursing Facility to get this, or the Autumn View. But down the road, ladies, would this help anybody who's not diagnosed with COVID?
Monoclonal antibodies are used in other circumstances, but I think that's up to, a conversation that you would have with your individual primary medical physician.
And again, the people who are even getting this monoclonal antibody infusion are still going to be vaccinated in a matter of time, correct?
Absolutely.
Yeah. So in the meantime, if what we have is vaccinations, that's what you want to get. But this is very, very exciting. Ladies, I'm going to refer people over to your main page at the McGuire Group if they'd like to learn more, or if they would like to talk to either of you. And we have had Danielle Reusch on the phone. She is the assistant administrator over at the Harris Hill Nursing Facility. And we have Annie Spano, who's the director of nursing at the Harris Hill Nursing Facility. Their main number is 632-3700, okay? That's the Harris Hill Nursing Facility. And it's just really, really exciting news to know that the Harris Hill Nursing Facility is the first nursing home in Western New York to offer monoclonal antibodies for treatment of high-risk COVID-19 patients. So we're talking pretty much about seniors ages 65 or older who might be high risk, who have been diagnosed with COVID, but who have a very mild case of it. Those folks, those inpatient residents, are getting the opportunity to be treated with this incredible monoclonal antibody infusions. And as we said at the top of the show, an antibody infusion is a proactive treatment where you're getting the antibodies different from the vaccine that helps you make the antibodies in your body. So it's very, very exciting news to know that here folks in Western New York are being helped, and that's what's important. We want to thank Danielle for being with us, and Annie, and we want to thank the McGuire Group and the Harris Hill Nursing Facility for passing on such great information. And remember, everybody, you heard it here on Senior Radio Buffalo.